Have you ever considered what constitutes normal behavior? Is it strictly the majority's behavior, or perhaps it's simply what society deems acceptable? Today, we delve into a fascinating topic that blurs the lines of what's considered normal: somatoform disorders. Somatoform disorders are a family of psychological disorders characterized by physical symptoms that mimic physical disease or injury, for which there's no identifiable physical cause. These aren't cases of malingering or of faking it. People with somatoform disorders genuinely believe they have a physical illness. Consider the story of Jane. She was an active, vibrant woman in her early 30s, yet she constantly complained of severe fatigue and muscle weakness. She underwent numerous medical tests, all of which returned normal results. Doctors couldn't find anything physically wrong with her. Eventually, she was diagnosed with a somatoform disorder, specifically chronic fatigue syndrome. Or take the case of Tom, a middle-aged man who was convinced he had heart disease. Despite multiple tests showing his heart was healthy, he experienced chest pain and shortness of breath. After a series of consultations, psychologists diagnosed Tom with somatoform disorder, specifically somatization disorder. These stories highlight that somatoform disorders are not simply all in the head. They are complex conditions where mental health issues manifest as physical symptoms. The people suffering from these disorders aren't making up their symptoms. They genuinely feel the pain or discomfort, yet medical tests show nothing physically wrong. Somatoform disorders can be incredibly challenging to diagnose and treat. They require a multidisciplinary approach, often involving psychologists, psychiatrists, and primary care physicians working together to manage the patient's symptoms and improve their quality of life. Treatment usually involves cognitive behavioral therapy, which helps patients understand and change thought patterns, leading to behavior causing their symptoms. Medication like antidepressants and anti-anxiety drugs may also be used. In conclusion, the concept of normal behavior can be misleading and may not account for disorders like somatoform disorders that blur the boundaries between physical and mental health. Today, we've learned that somatoform disorders are a group of psychological disorders where physical symptoms can't be traced back to any physical cause. We've seen through the stories of Jane and Tom that these disorders are genuine and not a result of malingering. We've also learned that these disorders require a multidisciplinary approach for diagnosis and treatment. Remember, understanding and empathy are crucial when dealing with somatoform disorders, as with any other mental health issue. So, next time you encounter someone whose behavior or complaints seem abnormal, consider that they might be wrestling with something that's not immediately visible or easily understood. It's always better to extend a hand of understanding rather than a finger of judgment. Thank you for joining us on this journey to understanding normal. Until next time, keep questioning, keep learning, and always challenge the normal.